Right, so I was telling you about pretracheal fascia. It forms the ligament of Berry that we know, and it forms a false capsule around the thyroid gland. Now, another very important thing about this is that if the question is that which of the fascia blends inferiorly with the arch of aorta and the fibrous pericardium. So this is such a fascinating thing. The answer would be pretracheal fascia. Pretracheal fascia, it lies in front of trachea and it encapsulates thyroid gland, yes, but it also blends inferiorly with the heart, with the arch of aorta and the fibrous pericardium of the heart. So that's one good thing. And these are the attachments: superiorly hyoid bone, oblique line of thyroid cartilage, cricoid cartilage. And yeah. Then neck infections in front of pretracheal fascia may bulge in the suprasternal area and extend down to the interior mediastinum. Thyroid gland and all thyroid swellings move with deglutition, which is swallowing, because of the thyroid, which is attached to the cartilages of the larynx, cricoid and thyroid cartilage, by the suspensory ligament of Berry. Also very important here, I want to show you this is the Berry ligament or the ligament of Berry, which is formed by the pretracheal fascia and it extends from the false capsule of the thyroid gland. And this basically also this also wait sorry this also covers, what do you call it, it has this recurrent laryngeal nerve in between it. So this is a very common side of injury of recurrent laryngeal nerve, so that's something that you should know. Moving forward, we have prevertebral fascia. This forms the floor of the posterior triangle of the neck and it extends to superior mediastinum, and its interior layer is known as alar fascia. And there's a clinical of this also that I'll tell you when we okay. And also this forms the axillary sheath, right? And it is separated from the pharynx and buccopharyngeal fascia by the retropharyngeal space. So there's retropharyngeal space in the middle behind the pharynx. There's a retropharyngeal space, and then at the back you'll have your uh, this fascia, which is prevertebral fascia. So prevertebral fascia is here. This is your retropharyngeal space, and this is your buccopharyngeal fascia. Now, in the retropharyngeal space, we'll have the lymph nodes. Carotid sheath, it is formed by the interior aspect of pretracheal fascia and prevertebral fascia, the posterior aspect of prevertebral fascia. It has common or internal carotid arteries, internal jugular vein, vagus nerve. It has ansa cervicalis embedded in the interior wall. Right here, you can see in this diagram. Then buccopharyngeal fascia, it covers buccopharyngeal fascia. So it covers the buccinator muscle as well as the constrictor muscles of the pharynx externally, and it behind it lies the, so you have buccopharyngeal fascia, then you'll have the retropharyngeal space, and behind the retropharyngeal space retropharyngeal space, which has the lymph nodes, you'll have the prevertebral fascia. Prevertebral fascia is there, and also the region between the alar, which is the interior layer, and the prevertebral fascia, that region is known as the danger space in the neck. Then you have pharyngobasilar fascia. This is thick, especially in the upper part of the superior constrictor muscle and the base of the skull. It lies deep to the pharyngeal muscles. Then this is the retropharyngeal space, which is dead space behind pharynx. It acts as a burst of expansion of pharynx during deglutition. And it has buccopharyngeal fascia anteriorly, prevertebral fascia posteriorly. This I've already told you. And the sides it has carotid sheath. And it has retropharyngeal lymph nodes and plexus of vessels and nerves and loose alveolar tissue. Clinical anatomy: pus collection due to lymph node abscess which lies in the paramedian position. It should be differentiated from cold abscess of spine or cervical vertebra, which is seen in median plane. So that is different and this is different. Okay, moving forward, when you talk about what are we left with? We're done with everything. Now we just have to look at the MCQs. Let me go there. Here, you can see they're saying that which MCQ shall we discuss? This one. Investing layer of cervical fascia encloses all except, so it has two muscles, two salivary glands, and two spaces. And then ligament of Berry is formed by investing layer of cervical fascia, no. Prevertebral fascia, no. Buccopharyngeal fascia, no. It is formed by the pretracheal layer, correct? Pretracheal fascia. So yeah, that's it.